back to other work that's been going on. Again, this is the Joint Committee, Standing Committee on Health and Human Services. This is a regular scheduled appointment, and we'll be talking about the budget in the morning and some bills in the afternoon. We're learning our way through the technology and getting better at it, but now we're up against the challenge of getting enough people in the room at the same time. So I've turned off my cell phone and asked everybody to do that and keep themselves on mute in the committee as much as possible. Stay visible as you're available. And then we've already talked about not using the chat for anything other than helping the meeting move along. If you're testifying, hopefully you've identified yourself correctly so we know who you're talking to. You can go to the YouTube channel, which can be found at legislature.maine.gov, looking up under HHS, Health and Human Services, and you can watch from there. And when you're done testifying, if you could go back to that, that would be great. The chat function's been turned off for anybody who's joined us, and we'll quickly do some introductions around the committee, starting with Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Cadescag.
Representative Connor.
Good morning. Thank you, Mr. Chair. My name is John Connor. I represent House District 58, which is part of Lewiston.
Representative Craven.
Mr. Chair, good morning. I'm Margaret Craven, and I represent House District 59, which is also part of Lewiston.
Representative Madigan.
Good morning. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Representative Zager.
Hello, everyone. Thank you, Mr. Chair. Sam Zager. I represent District 41 in Portland.
Representative Lemelin.
Good morning. I'm Michael Lemlin. I represent District 88, Chelsea, Jefferson, Whitefield, and half the Nobleboro.
Representative Meyer.
Good morning. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is Elliott and parts of Kittery and South Berwick.
And I'm Ned Claxton. I represent Senate District 20, which is Auburn, Minot, and Mechanic Falls. Our committee is wonderfully served by our staff, who includes Anna Broom.
Hi, I'm Anna Broom. I'm one of the legislative analysts in the Nonpartisan Office of Policy and Legal Analysis.
And Erin Dooling.
My name is Erin Dooling. I'm a legislative analyst from the same nonpartisan office.
And Carrie Withy.
Good morning. My name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee.
We're also joined today by Luke Lazur.
Good morning. I'm Luke Lazar. I am a senior analyst in the Nonpartisan Office of Fiscal and Program Review.
And since Deputy Commissioner Mann has been a regular participant, why don't you go ahead and identify yourself?
Good morning, everyone. Benjamin Mann, Deputy Commissioner of Finance at the Department of Health and Human Services.
And Mr. Wiley.
Good morning. I am Jeff Wiley. I am the Budget Director for the Department of Health and Human Services.
Thank you both for being here. Molly Bogart.
I'm Molly Bogart, Director of Government Relations for DHHS.
Okay, so thank you for that. Anybody who needs to excuse themselves, please should, and then we can get started with Luke on today's journey.
Excellent. So today we are going to be doing the adult mental health portion of the budget, the developmental disabilities and intellectual disabilities portion of the budget, and finally we'll end with elder services, including NIF, which is the nursing facility portion of the budget. So we'll start with the adult mental health. This is on page 1 of the green document. It starts with line 21. And since I believe that not everyone has their packets yet, I will continue to share my screen. Hopefully today can be the last of that, but I will put that up on screen. So we'll start with line 21. This is in the Dorothea Dix Psychiatric Center. It's account Z222. This provides funding for the Integrated Care Management System at Dorothea Dix Psychiatric Center. And I'll just note that Dorothea Dix is also known as DDPC. And I think to shorten up some of what we say going along, I will use that acronym going forward. Not seeing any questions there. I'll move on to lines 22 and 23.
Sorry, Luke.
Yes.
I don't, Carrie and I both can't, neither of us can see what you're sharing.
It
It's
says
just
you started screen sharing.
started screen sharing, but
Let me see.
it's just black.
I'm going to stop the share and I'll try it again.
So while you're doing that, because anybody who does not have the colored sheets, can you put a thumbs up or a hand up so we can know about that? So that means everybody looks like they've got their colored sheets. So that's an upgrade. That's good. Okay, Luke.
All right, great. So then we'll move on to lines 22, 23. Line 22 is in the DDPC disproportionate share account, and line 23 is in the regular DDPC account. These continue one limited period public service manager 3 position, funded 36.08% in fiscal year 21 and 22, and 36% in fiscal year 22 and 23 general fund in the disproportionate share DDPC account, and 63.92% in fiscal year 21 and 22, and 64% in 22-23 in the other special revenue DDPC account. This provides funding for related all other costs and transfers all other to personal services to fund the position. This position was continued by a financial order, and it ends on June 17th, 2023. And I'll note again, like yesterday, as it noted in the initiative, it transfers funding from all other to cover the cost of this. That's why when you look at the total state fiscal year 22 and state fiscal year 23 costs in the last 2 columns, they're empty. It's because the all other offsets the personal services cost.
Okay.
Next, I'll go to lines 24 and 25. These are in the same accounts as in the previous initiatives. This establishes one psychiatric nurse practitioner position funded 36+% general fund in the DISH DDPC account, and 63.9225% other special revenue in the DDPC account to assist the psychiatrists and physicians and to avoid higher locum tenens contracts. The initiative also provides funding for related all other costs and transfers all other to personal services to cover the cost of the position.
Okay.
Questions? I'll move on to line 26. This is in the Riverview Psychiatric Center account Z219. Similar to DDPC, this Riverview is often called RPC, so I'll try and shift to that to shorten up what I have to say. This provides funding for the integrated care management system at Riverview Psychiatric Center. Not seeing any questions. I'll move on to lines 27 through 30. You can see that this is in the DISH, which is disproportionate share, the DISH RPC account, the DISH DDPC account, and then in the regular RPC account and regular DDPC account. This adjusts funding for positions in the Riverview and Dorothea Dix Psychiatric Center as a result of the increase in the federal medical assistance percentage. The blended rate is now 63.92% federal expenditures fund and 36.08% general fund in fiscal year 22, and then 64% federal expenditures and 36 general fund in fiscal year 23. Next is line 31. This is in the Mental Health Services Community account Z198. This continues one limited period Public Service Manager 3 position previously established by financial order to serve as the Deputy Director of Strategic Planning, managing the grant, contract, administrative, and finance teams and communications, and reduces all other to to fund the position through June 17th, 2023. Next is line 32. This is in the Mental Health Services Community Account, C198. This continues one limited period Public Service Manager 3 position in the Mental Health Services Community Program, General Fund, to serve as the Deputy Director of Research and Evaluation. It transfers all other funding to Personal Services to fund the position. This position was previously established as a limited period position by a financial order and will end June 17th, 2023. Move on to line 33. This is also in the Mental Health Services Community Account, C198. It provides funding to continue the Crisis Center in order to meet the requirements of the consent decree to provide crisis services in Cumberland County. Line 34.
We have a question from Representative Zager.
Thank you, Mr. Chair. Is that the 774 Help Crisis Center?
I'm not honestly familiar with that name directly, but this is I can confirm that it's not. This is a new crisis center that we're establishing as part of the crisis continuum of care in Portland. So it does. We made the award earlier this year, and we're working on the contract, and it's slated to open later this year.
Okay, thank you.
Okay.
Seeing no other questions, I'll move on to line 34. It's in the Mental Health Services Community Account, Z198. Reduces funding in the Mental Health Services Community Program by reorganizing contract savings and program efficiencies. Move on to line 35. It's also in the Mental Health Services Community Account Z198. It establishes
Question from Representative Craven.
I had a question about line 34, and I just wondered where could I have a better explanation of where how the savings were achieved?
Certainly. We discussed this a little bit last week, but 1.5 of the 1.7 is coming from these supplemental contracts for PNMIE providers. Just as for context, we reimburse them like we do for any PNMIs for medical services for the staff delivering those medical services at those residential facilities. And we also, for PNMIEs, have separate room and board contracts. These other contracts, so those are existing and will remain in place. These are other contracts. It's not really a word for them. I just refer to them as supplemental contracts on top of those, only for certain providers. They've been reduced in prior years, and we're proposing to eliminate them. And if there's appropriate medical services that can be covered under main care, or if they're also aligned to room and board, they could seek increasing those budgets. But we would be eliminating these supplemental contracts for equity and parity, so that all providers of these services, these facilities, are treated the same. And there's also we've worked for a long time on trying to determine the outcomes by which these contracts are delivering, and have had some challenges on that front as well.
I just wondered if there was any reduction in services and direct services to people.
It's a reduction in funding that's going to be flowing to the providers, but I would the room and board contracts and with the medical service contracts, I would guess that they would be able to provide services to the same number of people.
Okay.
All right, we'll move on to line 35. This is in the Mental Health Services Community Account Z198. This establishes one Public Service Executive 3 position, one Social Service Program Manager position, and 8 Intensive Case Manager positions funded 100% general fund in the Mental Health Services Community Program to coordinate services related to individuals with forensic health needs across the state. It also provides funding for related all other costs. Next, lines 36 and 37. This is in the Mental Health Services Community Account Z198 and the Office of Substance Abuse and Mental Health Services Account Z199. This establishes one Public Service Manager 3 position, funded 50% general fund in the Mental Health Services Community Program and 50% general fund in the Office of Substance Abuse and Mental Health Services Program to serve as the Deputy Director of Operations. Next is line 38. It's in the Mental Health Services Community Account Z198. This provides allocation to align with available resources, and this is specifically an increased allocation in the federal block grant funds. Next is line 39. It's in the Mental Health Services Community Program, account Z198, provides funding to increase an agreement with a statewide organization for disability rights to expand advocacy services for community-based mental health services. Next, we'll move on to lines 40, 41, 42. These provide allocation to align with available resources. The RPC account Z219 is an increase in other special revenue allocation. Line 41 is, again, RPC account Z219 increase to another other special revenue fund allocation. And the last line is a DDPC account Z222 increase to the other special revenue allocation. The last initiative on the green document for the adult mental health is line 43. This is in the Mental Health Services Community Program. It's account Z198. This provides funding for the approved reclassification of one Behavioral Health Program Coordinator position to a Social Services Manager 1 position retroactive to February 2019. So next we'll move to the purple document and we'll look at the two pieces of language that go along with adult mental health. The first one is part UU. This is line 495 on the purple document. This part authorizes the Department of Health and Human Services to transfer by financial order available personal services balances in the disproportionate share Dorothea Dix Psychiatric Center program, the disproportionate share Riverview Psychiatric Center program, and the Riverview Psychiatric Center program, and the Dorothea Dix Psychiatric Center program in order to provide flexibility in the payment of operational expenses. Seeing no questions, we'll move to part VV, which is line 496. And this part renames the Office of Substance Abuse and Mental Health Services within the Department of Health and Human Services to the Office of Behavioral Health. All right, hearing no questions there, we'll move on to the next part that we're going to discuss today, and that's developmental disabilities and intellectual disabilities. The initiatives on the green document begin on page 7 at line 117. So line 117 and 118 is in the Developmental Services Community, account Z208, and the Office of Main Care Services, account 0129. This provides funding to contract with a provider to implement and provide technical support for the use of a standardized developmental disabilities needs assessment.
Is that an assessment tool that already exists, or will that be developed?
It does not exist currently.
Okay. Has that gone out to RFP, or is that being developed in-house, or?
Sure. The tool is really more of a process and an approach and a tool to determine the right level of support for members on the adults with intellectual and developmental disabilities, whether and how they fit into the 5 waiver programs that we have.
Mm-hmm.
So we would competitively go out for a contract with that to determine the right conflict-free third-party assessment provider to deliver those services.
Okay. Thank you.
Sure.
Not seeing any other questions, we'll move on to lines 119, 120, and 121. These are in the Developmental Services Community, account Z208, the Crisis Outreach Program, account Z216. This transfers and reallocates 4 mental health worker 3 positions from 100% general fund in the Developmental Services Community Program to 52.4% general fund and 47.6% other special revenue funds in the Crisis Outreach Program, and adjust funding for related all other costs. Move on to line 122. This is in the Developmental Services Community, account Z208. It reduces funding by recognizing one-time savings achieved by implementing new programmatic management practices for emergency transitional housing.
Yes, Representative Craven.
Maybe Mr. Mann could talk about that a little bit, because I'm not familiar with it.
Certainly. So I guess just financially, this aligns with prior year expenses, so there should not be an impact to services being delivered for this program. Just to confirm, we're on line 122, right?
Yes.
Yes. Just want to make sure I was answering the right question. So that is the case for this. We are more the emergency transitional housing. They're paid all with state dollars, and when an individual qualifies for this service, they usually also qualify for one of the reserve priority 1 waiver slots on section 21. So we, with better and improved management of the program, we can serve people off of on the main care side as opposed to the state side, which would allow us to offer up savings on this side of these services, which are, like I said, state dollars.
So are these in-house services that are provided, like a crisis service or something?
No, they're contracted out. We would, they're a contractor, a provider delivers the services.
All right, next is line 123. This is in the Developmental Services Community Z208 account. It reduces funding one time in the Developmental Services Community Program due to general fund efficiencies.
General fund efficiencies. Can you explain that phrase?
Yep. General efficiencies, program efficiencies. We've, as part of the construction and development of the budget, we took a hard look across all of our programs to determine what savings would have the least impact to services. And one of those approaches, like the previous initiative, if there's modest savings year over year in the same account, we can reduce the funding overall in that account and generate savings, which is what is happening here.
Okay. Representative Meyer, did you have a question?
Along the same lines, there is in the explanation here, it's possible that services could be impacted. So I'm just not following on this one. If you could just explain a little bit more about what we're doing here.
Maybe Jeff could look up the baseline. I don't know what percentage cut this is, but we can determine that. It's fairly modest. Given the financial situation that the state is facing, we had to come up with savings initiatives, and we did that across all of our programs. Every program office, the 7 program offices and the 2 state hospitals all offer up savings in this budget. And we prioritized savings that, maximizing revenues like we've been talking about with FMAP or other special revenue as the priority, since those have no impact. Program efficiencies and general efficiencies is a second bucket that it should not have an impact. I think this would, we're reducing the budget, proposing to reduce the budget here on a one-time basis for the biennial for this program. So I can't definitively say that there is no absolute impact. It does reduce it modestly, but based on prior year expenditures, I don't think it will have a limited, if any, impact on the delivery of services.
If I could add, it's a 0.8% decrease on a one-time basis.
Great. Thanks, Jeff.
Thank you.
Representative Craven, you had a question?
Well, I did, although most of them have been answered now, but it's just that there's been, and I appreciate that you have to find savings in this terrible time, but there's been so much angst in the developmental disabilities. The providers have just been struggling, trying to keep their doors open. And so I just worry about any small cut that they have, because I worry that a lot of them are just not going to survive until July 1st. Although this is probably going to happen after July 1st, but going forward. So thanks.
This account does not provide funding for direct client services. And to that point, we'll discuss later on in the budget. We have a $32 million annual proposal for rate increases for sections 21 and 29, which are the 2 main waiver programs that do provide direct client services.
Before you go on, I noticed that Representative Javner has joined us.
Good morning. I'm Representative Kathy Javner. I represent House District 141, which is located in Penobscot and Washington counties.
Okay, Luke.
Great. So I just wanted to add, so Jeff gave you the percent decrease, but I'll just give you what the baseline for this particular general fund account is 22.6 million, just to give you some idea of how that 200,000 relates to the baseline of the budget. So lines 124 and 125 are in the Crisis Outreach Program, account Z216, provides funding for the proposed reclassification of 47 mental health worker 3 positions to community integration worker positions, and provides funding for related STACAP charges. Next is lines 126, 127, and 128. This is in the Developmental Services Community account Z208 and the Crisis Outreach Program account Z216. It transfers and reallocates one human services caseworker position from 52.4% general fund and 47.6% other special revenue funds in the Crisis Outreach Program to 71% general fund within the Developmental Services Community Program and 15.2% general fund and 13.8% other special revenue funds within the Crisis Outreach Program, and transfers funding for related all other costs.
I notice we've been joined by Representative Stover. Would you care to introduce yourself?
Good morning. My name is Holly Stover. I represent House District 89, including Booth Bay, Harbor, South Port Edgecombe, West Port Island, and part of South Bristol. Thank you.
Thank you. And back to Luke.
All right, so we'll move on to lines 129, 130, and 131. This is in the Developmental Services Waiver Supports account Z212, in the Medical Care Payments to Provider account 0147, and the Medicaid Services Developmental account Z210. This provides funding for individuals with intellectual disabilities to receive services pursuant to Department's Rule Chapter 101 Main Care Benefits Manual, Chapter 2, Section 29, Support Services for Adults with Intellectual Disabilities or Autism Spectrum Disorder.
Okay.
All right. Move on to lines 132, 133, 134, and 135. These are in the Developmental Services Waiver Main Care account, Z211, the DDID Services Waiver Supports account, Z212, the Medical Care Payments to Provider account, 0147, and the Medicaid Services Developmental Services account, Z210. This provides funding to increase rates for services under the Department's Rule, Chapter 101, Main Care Benefits Manual, Chapter 3, Section 21, Allowances for Home and Community Benefits for Members with Intellectual Disabilities or Autism Spectrum Disorder, and Section 29, Allowances for Support Services for Adults with Intellectual Disabilities or Autism Spectrum Disorder.
So how does this relate to the 22.6 million baseline?
That was a different account.
Different account number. Okay.
That was a different account. Yes.
Okay. And can you speak to what the rolled up cost of this initiative is as a proportion of the current budget baseline?
I do not have that handy, so.
I did calculate that a while back. I believe it's right around 6%. The waiver programs pay out in excess of $500 million. But I can confirm that for you, Senator.
Yeah, that helps with the perspective. Thank you.
Not seeing any other questions, we'll move on to lines 136 and 137. These are in the Developmental Services Community account, Z208, and in the Brain Injury account, Z213. This transfers one part-time social services program specialist 1 position from 100% general fund in the Brain Injury Program to 100% general fund in the Developmental Services Community Program. All right, so next I'll move on. This is the first initiative we're going to come to that is part of all the consolidations that the department is doing, which is consolidating a number of accounts down into a much smaller number of accounts. So first I'll just walk through these initiatives, but I will show you a document which is posted on the website, and I will also email to the committee, which it includes all of the different consolidations that the department's doing, and it just summarizes what each individual consolidation means. I've inserted some information on that document to try and give you, the committee, some idea of what impact, if any, that consolidation will have on your ability to get information directly from me, at least. So I'll walk through that a bit, but first I'll just go through this first initiative, and this impacts multiple accounts. It's the Medicaid Services Developmental Services account Z210, the Developmental Services Waiver account Z211, the Developmental Services Waiver account Supports, which is account Z212, the Traumatic Brain Injury Seed account, which is Z214, the Medicaid Waiver for Other Related Conditions account, which is Z217, and then the Medicaid Waiver for Brain Injury account, which is Z218. So this increases funding in the Medicaid Services Developmental Services Program and decreases funding in the Developmental Services Waiver Main Care Program, the Developmental Services Waiver Supports Program, the Brain Injury Program, the Traumatic Brain Injury Seed Program, to consolidate the 6 Developmental Services Waiver programs into one program as part of the consolidation of main care related programs from 13 to 4. So I'm just going to quickly jump over to the document I've created. This is the first initiative like this, and it's the first one on my document. So you see it has the same information here. But what I did do is first I summarized at the bottom, and you can see they're all general fund accounts and all the transactions sum to 0. So all the activity that's in the accounts Z211, 212, 214, 217, and 218, those are all reductions, which then moves the funding essentially to the account Z210, so that all of the services that are encompassed in those different accounts now will be under that one account. So I'll give you sort of what I identified as I went through to look at this. So the account that is receiving all the funding is now going to be an account that handles all the HCBS waivers that are the Section 18 waiver, the Section 20 waiver, the Section 21 waiver, and the Section 29 waiver. So they'll all reside in one account. From the perspective of you as the legislature trying to track things, it is a little harder just because the general fund dollars for these accounts will not be separated out. But from the perspective of me going and trying to track down these costs, a lot of these costs can be identified in the accounting system in other ways other than these specific appropriations. So what this does do is it makes the transactions that go on in the accounts easier for the department. I know that when I was with the department, this was something that was discussed many times because there's a lot of financial orders that end up happening just to move funding from one of these accounts to another to make it through the year. What this does, it just puts all the money in one account, which should limit a lot of that extra work. So as I said, I can still largely identify most of these costs. There does become a little bit of a difficulty with the developmental services waiver and the developmental services supports waiver, just because all of the costs for those 2 separate waivers is included in one object code, which is the identifying factor for me in the accounting system. So what that would mean is if I were asked at a given point in time for information on those, on one or the other of those waivers, it would be a little harder for me without information from the department to be able to tell you exactly how much is being spent on one or the other, just because of the way that the accounting system accounts for that information. So that's the one drawback to this particular initiative. But in general, everything is moved to one account, and all those HCBS waivers, and HCBS is home and community-based supports waivers, which is a very specific type of waiver that we have a number of. All of these waivers end up under one account. The only HCBS waiver that would be not included here is the Section 19 waiver, and that's because that's a waiver that's specifically for adults and elderly. It's not for those with intellectual or developmental disabilities. So that's my basic information on what this means, and I'll then go back and open it up for whatever questions you may have.
Representative Zager.
Thank you, Senator Claxton. Luke, I appreciate that consolidation summary document. Does consolidation empower or disempower the various programs from doing what they need to do due to different portions of language?
No, because currently all of those waivers have their own separate section of main care policy in the main care benefits manual, and all of that will be done exactly the same now as it will be done then the way it is done now. All the programs are run out of the Office of Aging and Disability Services as well. They're the main office that runs them. Main care has a part in the sense that there is a big piece of federal funding and there are waiver applications that have to be filled in. And so main care works with those offices to handle the administration, but the ODES is really the head office when it comes to running those programs. And all of them are going to be run exactly the same as they are now. It's just that the funding itself will just be in that one account, Z210. All the general fund funding will be in that one account because the federal funding still comes from a main care account.
Okay, thank you so much.
Not seeing any other questions.
Yeah, I would just add, that was a great summary, Luke. I appreciate that. And just our goal with this, and there is no impact whatsoever to providers on this, is all behind the scenes accounting and managing of the money so that we can most efficiently push it out to the providers through the rates that are established. Our goal is just simplicity here, transparency, and to better manage those accounts. We send a monthly report over to OFPR and have started the conversation around what that could look like with account consolidation as well. And we can work on that to ensure that that there's no reporting or there's a better improvement of transparency from the current accounting structure to what we're proposing here. And it will, like Luke said, this will allow us to better, some of these accounts are fairly volatile in terms of week by week or month by month spending, and consolidating them will allow us to better avoid cycle crashes, which is when we don't have enough money in a particular appropriation to pay out, or emergency supplemental requests for particular accounts. And I think it will improve, instead of looking at like FMAP changes across 13 accounts. If you could just know that this is the FMAP change for all the waiver programs, I think it will provide a degree of simplicity and improved insight into what the department is doing, despite the fact that there would be fewer appropriations at the end.
Fewer appropriation lines. Right. Okay. Does that answer your question, Representative Zager?
It does. Thank you very much.
Okay, Luke.
All right, so that, if there are no more questions there, is the last line in the developmental disabilities and intellectual disabilities section. So we'll move on to elder services. This also includes some lines that impact nursing facilities within the main care section of policy. So we'll start with the elder services, which is on page 15 of the green document, and it starts at line 236. So line 236 is in the Office of Aging and Disability Services, Adult Protective Services, account Z040. It reduces funding in the Office of Aging and Disability Services, Adult Protective Services program due to the elimination of the bond requirement for a public guardian or public conservator under Title 18C, Section 5, 710. I will note that this change is happening because of a language part that we will look at later, but I'll note now, and I will note then, that this language part is not one that the HHS committee will be voting on. This is actually a piece of language that's actually in the Judiciary Committee's realm. So they'll be the ones voting on it. But this savings is directly because of that language part. Seeing no questions there.
I have a question.
Representative Craven?
Yeah, so if the person isn't going to be bonded, how are you going to, do the, what's going to happen when you're doing the background checks and stuff like that?
The same due diligence will be carried out. That process will largely remain unchanged. We simply won't go forward with the surety bond, which is essentially just a promise or to pay for the liability. But there shouldn't be an impact. I'd note that this was on the table last year as well. I think it had support, and it was just not voted on due to the adjournment early due to the pandemic.
Thank you.
No additional questions there. I'll move on to lines 237 and 238. These are in the medical care payments to providers account, the MAP account 0147. This transfers funding for a revision to the department's rule chapter 101, main care benefits manual, chapter 2, section 19, home and community benefits for the elderly and adults with disabilities, which allows enhanced federal medical assistance percentage for the community first choice option from the general fund to the federal expenditures fund within the same program. Nothing there. I'll move on to lines 239, 240, 241, and 242. This is in the medical care payments to providers account 0147 and the PNMI room and board account Z009. This provides funding to increase private non-medical institution services rates for inflation per the department's rule chapter 101, main care benefits manual chapter 3, section 97, appendix C, principles of reimbursement for medical and remedial service facilities. Next is line 243. This is in the ODES Office of Aging and Disability Services Central Office, account 0140. And it provides funding for the approved reorganization of one office assistant 2 position to a social services program specialist 1 position. Next is line 244. This is in the Office of Aging and Disability Services Central Office, account 0140. This establishes one social services manager 1 position to serve as a nutrition services manager focusing on nutrition-related programs under the Federal Older Americans Act of 1965, and 1 social services program specialist 2 position to serve as the aging services program specialist providing legal assistance, developer services as required by the Federal Older Americans Act of 1965. Also provides funding for related all other costs. There are no questions there. We'll move to the purple document as the end of the elder services portion.
There is a question from Representative Jabner.
Thank you, Senator Claxton. I apologize, Luke. I don't know if my hand isn't there. I'm not quite sure.
I didn't see it. It's on me.
Sorry. If the Deputy Commissioner could just explain a little bit more about the historical piece there of why we've been out of compliance and with, why COVID-19 all of a sudden has created this. I understand why the need has been raised, but why now all of a sudden, because of COVID-19, are we trying to get back into compliance? Why wasn't it fixed previously?
I think both are true. We would have, we've wanted to do this, or at least I've been here for a little bit more than a year. I know this has been a priority, and it's just become a higher priority with the degree to which both of these services or activities are being delivered to older Mainers right now. I think Luke mentioned these are all federal funds, so we're just establishing the authority. We're not using any general fund to pay for that, but I don't know the exact history if these positions existed at one time and were eliminated previously, or if they were just never filled. But I think it's a good thing that we're taking action to fulfill our obligations and be compliant with the Older Americans Act at this point, especially with home delivered meals is up 3x during the pandemic. And I think there's a lot of room, a lot of attention on that. And it'd be great to get this position so that we can make sure that the nutritional level of those meals and just the overall service delivery is both compliant with the law, but also meeting the needs of older Mainers.
Thank you.
Not seeing any other questions. We'll move over to the purple document. And as I said, we'll look at first part KK, and again, that's not language that this committee will vote on, but this is the language that eliminates a requirement that a public guardian or public conservator furnish a bond. And the other piece of language in elder services is line 498, which is part XX. This part authorizes a transfer of all other balances from any account within the Department of Health and Human Services, excluding balances in the 4E foster care adoption assistance and state-funded foster care adoption assistance programs for the purpose of the Information System Modernization Project in the Office of Aging and Disability Services.
Okay.
So the last area we're going to look at are the nursing facility related lines. These begin on page 25 at line 385. So the first initiative is lines 385, 386, and 387. These are all in the nursing facilities account 0148. This reduces funding by no longer allowing nursing facilities to claim reimbursement from the main care program for direct care costs for bed hold days, since no direct care is actually provided. Next is lines 388, 89, and 90. These again are all in the nursing facilities program, account 0148. This provides funding in the nursing facilities program for a cost of living increase in fiscal year 21 and 22, and a cost of living increase and rebasing in fiscal year 22-23. And the last line in this area and for today is line 391. Again, it's in the nursing facilities account 0148. It adjusts funding to align with existing resources, and this is a allocation increase in the federal expenditures fund.
And if we could know what that is as a percentage, that would be helpful too sometime.
Yes, I'm trying to do the math in my head. I believe we paid out $349 million all funds to nursing facilities in fiscal 20. So it's a little less than 10%.
Okay. Thank you for that. Representative Perry, would you like to introduce yourself and ask a question?
Oops. Oh, okay. Thank you. I'm Representative Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Bering, Callis, Charlotte, Robinson, Perry, Pembroke, and Pleasant Point. And my question is the no reimbursement for bed hold days, or at least the question is, are you taking away the cost of direct care, but not the room rent? Because quite honestly, that bed has to be held because it's that person's home. And especially through this COVID side, you know, that has been something that has kept nursing homes solvent. Does that mean they get nothing, absolutely nothing, even though they have to hold that room?
That's not accurate. There is a specific, claims are billed by providers through, if you break appropriations and object codes and you keep going further down, they go down to the code level. There's hundreds, thousands of codes across the main care account, across various activities. There's a specific code in the system that is constructed for the explicit intent of billing for bed hold days when a nursing facility resident needs to go to the hospital and that bed is empty for up to 2 weeks until they return. So that there is a system, and many nursing facilities are billing that bed hold code. Some are not. Some are continuing to bill bed hold direct care costs. There are no direct care costs when the resident is physically not in the facility. This is based on fiscal 20 payments and reimbursement to nursing facilities, less than 0.5%, and we do view it as a compliance issue in our on how costs are billed and paid out by the department and between us and nursing facilities.
Which you're saying then it's not really about a change in policy, but it's a change in regulation, a change in oversight.
I sort of. I mean, there's a specific. I would say it's a move to become consistent across how we treat bed hold days. Some facilities do use the code that's there for bed hold days. It is acknowledged that the rate is lower. That's because fewer services are provided, and we do pay money. We reimburse nursing facilities in a particular way when they have a bed hold, and we want to ensure that there's consistency across all facilities on how they are billing for bed hold days.
So is this a change in, I'm sorry, I don't mean to take up, but I'm trying to understand this. Is this a change in policy in terms of how you look at bed hold days? Or is this because some nursing homes are incorrectly billing?
I wouldn't frame it as a change in policy. The bed hold mechanism to get reimbursed has existed for a while. We are looking to enforce that more and have more consistency across nursing facilities.
So you're really talking about enforcement of something that's already in place.
That's how I would frame it, yes.
Thank you.
Senator Moore has joined us. Would you like to introduce yourself and ask a question?
Thank you, Senator Claxton. I appreciate that. Yes, I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well. And I really just want to make a comment. I'm quite concerned about us saying that they're not going to be able to bill for direct care costs, even when they have the beds on hold, because they still have to have the staffing. The staffing doesn't go away just because someone is in the hospital. So I'm thinking that there should be some way that we could do a waiver or something that would allow them, or allow for the direct care cost to be part of the bed hold reimbursement, because those costs are still there and they still exist. And I will point out that this was also in the supplemental budget, and I believe we as a committee did not approve it, approve putting it forward in the supplemental budget. Thank you.
A couple questions. So financially, that roll up is close to $1 million from 385, and the next two items is about $1 million. And is it fair to say that the $30 million expansion on 391 would be seen as an offset for the industry?
I just want to be clear on the 30 million. That is that is mostly an accounting transaction. That's we are pulling down. That's giving us the authority to spend money that we already spend. So that is not a new, or that's not tied to a rate increase. The rate increase is lines 388, 389, and 390. They total $13 million in 22, and slightly over, or right around $23 million in fiscal 23. I would note that since 2018, so from the change from 2018 to 2019 and 2019 to 2020, nursing facility reimbursement has increased by 22%, based on rates that were changed in LD 925 back in 2018, and then also LD 1758 in 2019, on top of the annual cost of living adjustments that are put in place and the rebasing that we just did this year. We also changed the way that inflation works in favor of nursing facilities on a one-time basis in fiscal 20. But again, those since 2018 rates have increased by 22% overall. So that $30 million is due to rate increases. We draw down more federal funds, and we are looking that $30 million is just for the authority to permanently draw down higher amounts on the federal side. You'll note it's all federal expenditures there. There's no general fund.
And as a separate question, I understood you to say that different of the nursing facilities use the bed hold day code differently. So that $1 million might disproportionately impact some of the nursing homes and then not others.
That's right. I believe that fiscal was based on the nursing facilities that were billing for direct care, and does not include the ones that are using the bed hold code that is in the system to be billed.
Yes. Okay. All right. So to understand that, facility by facility requires knowledge of how they use that code. Yeah. Okay. Thank you. Are there any other questions? Okay. Any other comments, Luke, before we finish up with this portion?
Nothing about this portion. I'll just note that when we do get together Monday at 1 p.m., we'll be discussing main care expenditures, including hospitals.
And we had to expand into Monday to leave enough room to get through our work on the budget in time for the March 19th deadline. So that may come as news to some of the committee members, but we'll make sure it gets on the calendar. Representative Meyer.
Thank you, Mr. Chair. Are we through here with Luke this morning on this section? Okay, so just a couple of questions that I've been jotting down as we've been moving through this, just additional information. So on line 33 on page 3, the new crisis center, just a bit of information about what we're talking about there. That's new to me. This would be the crisis services in Cumberland County. I think it was mentioned this would be in Portland. So I'm just looking for a little bit more information around that. Next line 34. So what I'm wondering there is we've made some cuts here. And I'm wondering if we can show if any of those savings are being reinvested elsewhere to eliminate wait lists in outpatient therapy or crisis services or in staffing shortages. So just what's happening with some of those cuts. And then popping over to developmental services, I'm wondering if we can have the total number of adults with IDD being served in each of these waiver sections: 19, 20, 21, 29, 50, and 97F. And then to wait lists, what are the updated numbers for 21 and 29 wait lists?
I can address some of those right now if you want, Representative.
Sure.
Just to go in reverse order, we do a quarterly update on our waiver services. It actually got posted yesterday or the day before this week on our website. We can send you the link. It includes the current wait list and the current number enrolled in all of the sections. I think that would be helpful, and it's directly responsive to your question there.
Perfect.
The good news is that waiver services enrollment on those waiver services went up in calendar year 20 across the board. Section 29 went up 7%. I believe Section 21 went up 2%. But you can, we'll certainly get you that information. It's, I believe it was a blog post on our newsroom there. We can get you more information as well on row 34 on the cuts that are proposed there. I would just note that we don't do direct, those savings are not realized or directly tied to other increases, but there is a noticeable investment in mental health across, one of which is the crisis center that you referenced off the top. We are furthering our work on mental health intensive outpatient services through Main Care. There's $1 million general fund request on that. We'll cover that on Monday. There's the options investment for SUD work through the Fund for Healthy Maine that we discussed a little bit yesterday, but we can get that the full overview on mental health investment. But I wouldn't necessarily, it's a reasonable thing to do, but I wouldn't necessarily draw a direct connection between cuts in one place and direct investments overall. I look at it more as a portfolio-wide approach. We made savings in all areas and also have investments in many areas as well to make sure that we are keeping in balance there. And finally, on the crisis center, this is a new-ish service. Primarily, I think the bottom line is intended for rapid assessment of folks in a mental health crisis in Portland, where it's going to be located in Portland, rather. We would, for example, we could have one of the intentions is for law enforcement to be able to drop folks off there so they can become stabilized. It's services up to 24 hours. It's also open 24/7 or will be open 24/7. This type of place is not does not exist now in the state, and we are excited about the opportunity to fill that gap in the crisis continuum of care for that. It's certainly it's a level down from residential services, and it also provides outpatient.
Thank you for that.
Commissioner Meyer?
It does, and I thank you for that. I believe Molly just sent the link to the blog post. Within that blog post, because I'm not going to have a chance to look at it right now, is there a breakdown of services being provided to individuals on the wait list? Sometimes I recall hearing that there are folks on the 21 receiving some type of service, and I wonder, do we know, is there a breakdown of the services? That's
a good recollection. I was going to mention the same thing. It has a wait list overall, but then some of the wait lists. Also, folks are receiving services off of other waivers. So it also provides that unduplicated wait list as well, which is lower because they are providing some services, although, perhaps in not as high a level as they need, because we have a wait list on Section 21.
Okay, thank you.
And I would note that doesn't include 50 and 97F, which I will work on getting separately.
Thank you, Ms. Bogart.
Representative Stover, did you have a question?
I did have a question. On A282, we talked about Meals on Wheels or delivered meals. So on Monday, when we discuss it, if we could look at what that initiative includes for funding, and also, I believe there's money in the purchase social service block grant for Meals on Wheels. Is just we know during the pandemic that this has been a really important outreach effort to isolated elders. And if we could just talk about the combined funding, and is that meeting the need of isolated elder people, especially right now?
Yeah, we can, we'll try to pull that for Monday. Just for a little bit of background, I think you likely already know this, but the Meals on Wheels and the home delivered meals, there's baseline funding that we deliver on an annual basis. And the CARES Act and other legislation related to COVID has provided considerable additional funds so that we've tripled or so our number of meals that we've delivered since it wasn't quite the beginning of the pandemic, but close to the beginning of the pandemic. And that funding is going through this calendar year for a large part of this calendar year. I'm not sure entirely when it runs out, but that level of additional support for home delivered meals will continue for some time.
That's good news. So thank you.
There's also a bill out there for an additional 1.5 million a year.
Also good news. Thank you.
Senator Baldacci has joined us. Would you care to introduce yourself and ask a question?
Sure, I'm Joe Baldacci. I represent State Senate District 9, which is the city of Bangor and the town of Herman. Thank you, Mr. Chairman. We heard from the chief operating officer at Northern Light Acadia last week, and one of their big concerns, I think that the department has it listed as a $900,000 cut, but they feel it's closer to $1.9 million cut to their budget. That's a big concern for us here because there aren't a lot of inpatient services, and there's already a crisis in that area. And I'm glad to see that the department is acting in some areas, but I mean, we need to address that cut because that will do substantial damage to mental health services in the Bangor region. So I just wanted to let you know how, obviously that's going to have a very adverse impact up here. And we're hoping, I didn't know if there was the reasoning behind that cut, if you want to address that.
I can try to. Which initiative are we discussing?
Oh, I'm sorry, I don't have the page number, but it was from the discussions regarding payment. Oh, it's when you reduce the reimbursement from 117% to 100%. That is the cut. And obviously the costs, the 100% doesn't capture all of their operating costs, and that's what they had been traditionally getting. So that's where the $1.9 million cut comes from. You can't address it now, that's fine. I would like some response from the department as to what the reasoning was for that reduction and whether they reviewed what the impact would be to people receiving services because of that.
Sure, we can talk. That's on slate on Monday in the Medicaid section. Generally, we had to make some difficult trade-offs in the budget, and 117% is obviously considerably more than what 100% cost is. We're reimbursing for 100% of cost. This 117% is, you could do the math on the incremental, $1.17 for every dollar spent. So, but
No,
we,
I understand that. I think part of it was that there was a lot of unreimbursed. But I would like the department to kind of address their reasoning on that proposal and whether they've recognized the impact it will have on everyday, in terms of this region, in terms of mental health services. Thank you.
Sure.
Representative Lemelin, did you have a question?
Yes, Senator, thank you. I guess I'm just confused on one topic, and that is with the Medicaid expansion that occurred, how is it possible to have so many people on a wait list?
The wait list for waivers.
Correct.
The expansion for Medicaid doesn't. There are separate determinations of need for eligibility for the waivers. If an individual has intellectual or developmental disabilities, then there would be that medical need determination made, and they would then work with the department on seeking the delivery of those services, whichever one that they, Section 21 or 29. And there's a whole host of a comprehensive suite of activities that are provided to those individuals. Medicaid expansion is really just increasing raising the financial threshold by which individuals can get on health insurance through Medicaid. So they wouldn't qualify. They're separate and distinct from a medical need perspective.
So you're telling me that the Medicaid expansion was only implemented to pour more people into the system and not to just help the people that are already in the system not getting the care that they desperately need?
The intent is completely different. I think the Medicaid expansion is providing health insurance to individuals that couldn't afford health insurance. I think that's a issue across the country, and certainly now during a pandemic when more folks are losing their job and health costs continue to rise. So those 70,000 plus people that have been able to avail themselves of health insurance in the middle of the pandemic now because of expansion that was rolled out in 2019, I think is, in my view, an unqualified win for those folks. And we can, we have an initiative in the budget now. I forget what line item it is, but there are, we are further expanding slots on Section 29, for example, so that we can continue to support the individuals that have intellectual and developmental disabilities on that front. But they are separate and distinct issues there.
Okay, are there any other questions? So I think we're done with the budget portion of this morning. I'll check in with Anna and Aaron to see if there's anything else we should be doing. I see one head shake.
We didn't get any volunteers for more reports for today either. Representative Jaffner was the only one that let me know she was going to do reports. So maybe there's volunteers I'm unaware of.
Anybody ready to do a book report, or
I can't read now.
We'll sign up for later? All right. And I saw on the agenda that we'll be reviewing the book reports that are due at the end of the session this afternoon. Is that what I see?
We didn't get any volunteers.
Right.
Okay, but we want to make sure they're assigned, and we may need to create different expectations. So we'll save that time at the end of the afternoon session to clarify that plan a little bit. Okay. If there are no other concerns or questions, I think that concludes this morning's work for HHS. Thank you to Luke and Commissioner Mann, Deputy Commissioner Mann, and to Mr. Wiley for joining us.
Thank you.
and to Molly, of course, for joining us. I'll entertain a motion to adjourn until 1 o'clock, when we'll have a public hearing on LD 93 and LD 98 in that order.
Motion to adjourn.
Yeah.
And a
Second.
second. All those in favor? See you at 1. Thank you. I'm Michelle. Do you have testimony you want me to read if you're going back and forth?
I do not. I will be here for 93. These are department bills, Senator, so I'm just going to be introducing Dr. Landry.
Oh, okay, great. All right.
And if I am called away after introducing LD 93, Representative Stover will introduce LD 98.
You got things covered,
I do.
and I'm not surprised. Thank you. So I think since we're reconvening, we don't need to go around and reintroduce ourselves again at this point. This is a Health and Human Services Committee meeting, and we'll be hearing two bills today, LD 93 and 98. And it looks like we have plenty of folks to go ahead and get started, and that we'll begin with Representative Meyer introducing LD 93.
Thank you, Mr. Chair. I assume we have Dr. Landry and Molly in attendance. Can we just give it a minute or so until they arrive?
Yes, that will be fine. And we also have Chantel Pettengill, which we can bring in as a panelist too. She'll be testifying. So for the record, it's not the committee that's holding things up. Yes, Anna.
Can I just let you know that on the committee website, we have the fiscal note for LD 93 and the current law for LD 98. And you should have all got the link that I sent with the testimony as well. You have to refresh it if you looked at it like half an hour ago and a couple of others came in. I'm still figuring out how to use it, but I just wanted to let you know about the fiscal note and the current law while we were waiting.
Okay. Thank you.
I do have a message out to the department.
Did you include their chief wrangler, Molly?
I did.
Okay.
Dr. Landry's on his way.
Okay. Representative Craven, you had a question.
Thank you, Mr. Chair. No, I did not have a question. I just wanted to welcome Chantel Pettengill. She's my constituent, and I'm looking forward to, I've read her testimony and look forward to hearing from her.
Oh, great. Mr. Landry has joined us as a panelist.
Excellent.
And is migrating.
There we go. Excellent. Shall I begin?
Well, let's give him a chance to make sure he's all set.
Okay.
And is Nick Murray testifying or just listening in?
For the next bill, Senator Claxton.
Okay, great. Welcome, Director Landry. Good to see you. So why don't you go ahead and get started, Michelle?
I will do that. Good afternoon. I am Representative Michelle Meyer, serving Southern Maine's House District 2, which is Elliott and parts of South Berwick and Kittery. And I am very pleased to introduce a department bill, LD 93, an act to improve Maine's quality rating system for childcare services. Dr. Todd Landry is here today to provide testimony, so I will yield the floor to the Director of the Office of Child and Family Services, Dr. Landry.
Thank you very much, Representative Meyer. Appreciate that introduction. Senator Claxton, members of the Joint Standing Committee. As introduced, I am Dr. Todd Landry. I'm the Director of the Office of Child and Family Services within the Department of Health and Human Services. Here today to testify in support and provide information to you on LD 93. This is an act to improve Maine's quality rating system for child care services, and it modifies the statutory requirements for the QRIS, the Quality Rating and Improvement System, by removing the requirement of a specific 4-step process and replacing it with a minimum number of 3 steps, which allows department discretion to set the appropriate number of steps that demonstrate work towards nationally recognized quality standards. This is in part and parcel with the work that we have been doing within OCFS for the past couple of years on childcare, and it is embedded in our belief that quality childcare systems really are contingent upon 3 key components, and those components are access, quality, and workforce. You'll also see these 3 steps evidenced in the Children's Cabinet goal around young children, and that goal is to eventually support and promote that all children are kindergarten ready. And again, if you remember the presentation that Anna Hicks and I did with this committee, it again references those 3 components of quality, access, and workforce. So from the quality perspective, over the last couple of years, we have undertaken significant work to improve quality across the state. The QRIS, the Quality Rating System, has proven to be an important tool in that work, as it is in most states in the country. The requirement of this 4-step system was codified in 2013, and we think it's time to revisit that current system. Specifically, what this act does is, or this bill does, is to modify it to a minimum 3-step system. But I want to be clear, our intent at this point is to move towards a 5-step, or more realistically, a 5-star system. We've piloted a 5-step system. It was very well received by providers and advocates. So we think the expansion of this is an important step forward. I'll simply mention and conclude that many of the rating systems that we in today's society are accustomed to, whether it be Rotten Tomatoes on movies or Uber and Lyft or Yelp on restaurants, are all really around a 5-star or 5 segment system. And so we think it actually makes more sense to align with that. We think it gives parents a more easily understandable rating system to look at childcare systems, because they're used to that 5-step or 5-category process. We've even had providers come to us and say, will you please change it? Because parents will ask them, you're only at 4, how come you're not a 5-star or 5-step system? And they have to explain that right now 4 is the maximum. So given where we are as a society, given where we're trying to move everyone to understanding the importance of quality and recognizing the quality of childcare, and given that it aligns perfectly with our goals on childcare and also embedded in the Children's Cabinet work, we think it's an appropriate step for us to move forward with. I appreciate your time. Happy to answer questions that you may have.
Are there any questions for Dr. Landry? Yes, Representative Jevner.
Thank you very much, Senator Claxton. Thank you, Dr. Landry. For the work session, and I would really like the 2016 report that is referenced here, that the recommendation came from for expanding the program to include 5 steps. Thank you.
Yeah, absolutely. We're happy to share that with you. I will warn you, it's about 104 pages, so don't let that don't let that scare you. It was done in partnership with DHHS, with the University of Maine and the University of Southern Maine. So that there's that report. I'm also happy to provide you with the report that we have done that is related to the pilot that I referred to. That pilot, I'd be happy to provide you that report as well in advance of the work session.
Yes.
Thank you very much.
Representative Zager.
Thank you, Mr. Chair. Dr. Landry, would that report also include a histogram or some sort of measure of how many of the childcare providers fall on each of the current stars of the steps of the system?
I believe that it is in the reports. What I will also point out is we report on that publicly on a monthly basis on our dashboard. And so you can go to our dashboard on a monthly basis and see exactly what the number and percentage of our providers are at each step. You can also then disaggregate it by county. You can disaggregate it by a type of provider, whether it be family or center-based provider. So that information is also publicly available.
Thank you very much.
Any other questions for Dr. Landry? My only question was, does this really require statute to change? Should we be undoing that? And should that just be under major technical for the department or something like that?
Well, as it's our understanding, and when we talk to the AG's office about it, because it is codified as 4 steps in 2013, it's our understanding that it does have to actually go through that. Now, one of the options that obviously the committee could consider is simply to say the department will have a quality rating system or something along those lines without reference to any minimum or maximum number of steps. That's another option that obviously we'd be happy to engage in a discussion on.
And that certainly wouldn't change the direction of what you're doing. It just might change. Anything we can do to prune the statutes is a good idea in my book. So
absolutely,
we'll consider that at the work session.
Consider that, yes.
Okay, good. Are there other questions? I don't see any at this point, so thank you for being here. Is there anybody else from your department that you'd like to have testify, or are we good?
No, I don't believe there's any other department testimony today.
Okay, so we have a number of people who have joined us. The first round should be people who are here to support the legislation. And so I defer to Chantel Pettengill as the next person in. If you'll unmute yourself and join us, that'd be great.
Hello.
Hello.
Let me take this off. Sorry, I'm at my front desk, but there's no one around. So I'm writing, I guess, neither for support or against. I'm a provider. I'm Chantel Pettengill. I own a large childcare center in Lewiston. I live in Representative Margaret Craven's district, but my daycare is actually in Representative Connor's district. So I have representation from both sides of that. Senator Claxton, Representative Mayor, and distinguished members of the Health and Human Service Committee, my name is Chantel Pettengill. I'm writing neither for nor against LD 93, but rather a request to change wording to allow more organizations of accreditation than just Head Start and the NAEYC accreditations. For the past 2 years, I've been a part of a childcare business coaching group that's international, which has over 300 childcare owner members from all 50 states, with members internationally as well. These providers range from nonprofits, profits, small childcare centers, large childcare centers, Montessori, Reggio, Waldorf, and a few operate private birth through 5 grade schools, as well as multi-center owners. By being a part of this national group, it has opened my eyes to various opportunities that are available for childcare accreditations. For the longest time, I thought the only accreditation opportunity was from Head Start, the NAEYC, and the NAFCC. However, through research, I found that there are other equally as high standard accreditation programs that fit the needs for diverse childcare programs of Maine. Examples of these agencies include the Accredited Professional Preschool Learning Environment, APPLE, which boasts over 1,000 member schools, and the National Early Childhood Program Accreditation, which has been operating since 1991. Both of these programs emphasize their flexibility. Their accreditation is flexible enough to be granted in a wide range of early childhood settings, including small centers, privately owned faith-based corporate programs, and center-based family home ministry faith-based university centers, among others. There are also specialized accrediting agencies such as the American Montessori, which credits only Montessori method programs, and the Association of Christian Schools International. Accreditation is valuable for many parents seeking these forms of education for their children. Some of the standards will be different due to the differences in philosophies and approaches. But like the others, these accrediting bodies ensure member institutes maintain rigorous standards. The one accreditation organization that many providers through my international child care coaching group are members of and received accreditation with is the Association of Early Learning Leaders. The National Accreditation Commission of Early Care and Education Program offers early childhood leaders the opportunity to demonstrate and document quality performance using research-based criteria and evidence-based practices. The National Accreditation Commission provides a comprehensive ongoing quality improvement system that recognizes the inherent diversity among programs through self-study and award processes. Only over 1,300 early learning programs in 35 states, the District of Columbia, and overseas participate, including university and college campus-based programs, private childcare, faith-based preschools, Head Start, public pre-K, corporate centers, DoD programs, and employer-sponsored programs and Montessori programs. By changing the wording on lines 7 and 8, which is or required by accreditation by the National Association of Education of Young Children, 2, required for accreditation by a National Early Childhood Accreditation Program, it will allow diversity as well as increase the number of high-quality childcare programs in the state of Maine, allowing us to offer these spots to more Maine families and children. Having childcare programs enrolled in accreditation programs means that programs are being held to the highest standards of quality as determined by experts in the field of early childhood education and meets the philosophy of their program. It takes serious and hard work to achieve accreditation status, and poor quality programs aren't going to make the cut. Thank you for your time and consideration. If you have any questions or would like more information on the variety of accreditation programs, do not hesitate to reach out to me. And on my written testimony, I've included my email and also my phone number for you to contact me at.
Thank you, Ms. Pettingill. Are there any questions for Representative Craven's constituent? I don't see any. Ms. Pettingill, thank you for submitting your testimony.
Thank you.
And we're also going to hear from Heather Martin. If you want to, you've already unmuted. Welcome.
Yes, thank you for having me today. My name is Heather Martin, and I'm here testifying on the behalf of the Maine Association for the Education of Young Children. I'm also an early childhood educator in a child care program, if you can see my pirate ship behind me. And I'm testifying in support of LD 93, an act to improve Maine's quality rating system for childcare services. So thank you, Senator Claxton, Representative Meyer, and distinguished members of the Health and Human Services for hearing my testimony today. With this bill providing a minimum 3-step requirement for Maine's quality rating system, it allows the Department of Health and Human Services to use research to inform practices in determining the best quality rating system that does work on behalf of our child care programs and our families accessing child care information. With this statutory language change, it allows for the department to use discretion in determining the number of quality levels, which provides flexibility to meet the needs of programs in the system. Maine Roads to Quality's Professional Development Network recently has been piloting a Rising Stars for Me system of new standards that sought representation from across the child care field for participation and feedback. So we strongly believe that taking this intentionality of including the early childhood professionals in the development of the system really demonstrates a commitment from the department to support a system that works for child care programs and early childhood educators. with research showing us that early learning experiences are strong predictors for future outcomes. We know that placing an emphasis on quality in early childhood education programs strengthens the development of the children they serve. Having measurements of quality informs families about the care and education their children are receiving, and it provides early childhood programs with information about improving their practices within their settings. When we do and support and invest in quality early learning, not only do our children benefit, but our communities and the economy benefit as well. So supporting LD 93 means supporting quality early care and education, strong families, and our thriving Maine communities. You can say hi, Zoe. So we are, very excited that we're starting to talk more and more about quality as we talk about early childhood education, and we believe that LD 93 helps support the quality of childcare in Maine. Thank you for hearing my testimony.
Thank you for being here. Are there any questions for Ms. Martin? I don't see any. Thank you for getting your printed testimony in, and we'll go from here.
Thank you so much.
And I see that Ms. Furlow has joined us. If you want to unmute and join us, that'd be great. There we go.
Hello again, Senator Claxton, Representative Meyer, esteemed members of the Health and Human Services Committee. My name's Rita Furlow. I'm the Senior Policy Analyst at the Maine Children's Alliance, and we're here today in support of LD 93. Maine's future depends on our ability to support our children's growth and development. And we know from brain science that the best way to support this development is to provide children with stable, responsive relationships and positive learning environments, as these really are the conditions that literally help to build the architecture of children's developing brain. And we know that children who participate in high quality early learning programs in the first years of life really develop the cognitive and the social emotional skills that can drive future success, both in school and in life. We view this really as a technical change that the department, as Dr. Landry has described, right? This is in support of a report that's been sitting around on the shelf for long enough, and we're very glad that that the department is moving this forward, and so yeah, we support this technical, something that we really see as a technical change to allow them the flexibility to go from 4 steps to 5 stars. And as he mentioned, this is a report that's been around since 2015. And I know you had a couple questions yesterday, I think, about childcare, and just to remind you that that the Child Care Development Block Grant really is the primary funding source from the federal government. And this block grant gives the administration the ability to support things like the quality rating and improvement system. And so we're strongly in support of that system and making it stronger. And it really is important for parents to understand and learn about the quality rating system, and to provide incentives for providers to increase their quality. So happy to answer any questions. Thank you for your consideration.
Thank you for being here. Are there any questions from Ms. Furlow? I don't see any, so thank you again. Is there anybody else to be testifying in support of LD 93? It doesn't look to be that way. And I don't see anybody signed up who looks like they might be opposed. And we've already heard from neither for nor against. So any questions about LD 93 that we want to direct to our analysts in anticipation of a work session down the road that haven't been raised already? Representative Javner?
Thank you, Senator Claxton. If we could just get a response from the department about the first testimony about including those other rating systems, that'd be really great.
Okay, any other questions or direction for the staff? So I'd also like to see at least a summative discussion about whether we need to change statute to enhance what's there or eliminate statute to give them more flexibility. The department more flexibility. Is that specific enough, Anna?
Yeah, I think that's going to ultimately be up to you, but I'll see what's necessary in the statute and talk to the department.
Okay, great. Thank you. That would be helpful. All right. So we'll thank Dr. Landry again, and we'll close the hearing on LD 93 and move to LD 98. We have a surrogate presenter this time, so I defer to Representative Stover.
Thank you. Thank you, Senator Claxton, and to the esteemed members of the Health and Human Services Committee. I am presenting on behalf of Representative Michelle Meyer on LD 98, an act to clarify Maine's statutes related to the licensing of childcare providers. And just quickly to summarize, this bill provides standardization and oversight for OCFS of childcare providers. And some of the key points that I think to consider is that it provides clarity on the department's ability to levy civil penalties against those who violate statutes or licensing rules governing childcare facilities. It also allows OCFS to regulate the quality of the program of childcare that is provided by the providers classified as family childcare. It allows the department to regulate the administration of medication by providers classified as family childcare providers. And lastly, it replaces all references to the certification of family childcare providers with references to licensure. So essentially what it's attempting to do is to bring greater oversight and also standardization of quality across childcare. And I think that Dr. Landry will probably give us a little more information about that, but the bill attempts to just raise the bar. Thank you.
Thank you for presenting that, Representative Stover. So, Director Dr. Landry, did you want to chime in?
Yes, thank you again, Senator Claxton. Thank you, Representative Stover, for introducing the bill, and to our thanks in her absence to Representative Meyer for sponsoring the bill. My thanks again to the members for allowing me to join you. For the record, again, I'm Todd Landry. I'm the Director of the Office of Child and Family Services within the Department of Health and Human Services, and here to testify in support of LD 98. As you just heard, the bill does would modify the statutory provisions regarding family child care providers to ensure alignment between requirements and regulatory authority for center-based child care facilities and family child care providers. Changes include allowing the department to regulate the administration of medication by family child care providers, regulating the quality of family child care providers, and the potential of levying civil penalties for family child care providers who violate statute or licensing rules. As you heard, this bill also changes the references to certification of family child care providers and replaces it with the term licensure, which we believe, again, is a critical alignment piece between the two types of providers. Now, this bill would provide OCFS with the ability to ensure that consistency between provider types and regulating those critical health and safety requirements, as well as provider quality, which you just heard about in the prior bill as well. I want to say in 2019 and 2020, OCFS undertook a significant amount of work to review and update the licensing rules for all child care provider types to ensure compliance with the Federal Child Care Development Block Grant. As you heard in prior testimony from Ms. Furlow, this is the primary way that the state of Maine supports child care providers is through that block grant. Since 2016, under the prior administration decisions, we were out of compliance with that federal block grant. And had we not come back into compliance, we would have been subjected to an $800,000 annual penalty to our child care development block grant allotment. Fortunately, through the work that we have done that includes some of these provisions here that we're proposing, we were able to mitigate that penalty, eliminate that penalty through the federal ACF Office of Child Care. So we're currently not in a penalty status. However, this bill now would in part codify those components so that we can safely remain within the requirements of the block grant and not be subject to those penalties going forward. The last thing I will simply say is that the statute, as currently written, does not allow OCFS to implement certain regulations which are needed to ensure equity across those provider types and compliance with the CCDBG. So for that reason, there is a significant potential impact to the state if we don't come into compliance and stay in compliance with the federal block grant. You have my written testimony. I'm also happy to answer your questions, and in the interest of time, I'll stop with my testimony and see what questions you may have.
Thank you for that. Are there any questions for Dr. Landry? So one of the things I heard in the prior bill, sir, was that there had been a fair amount of involvement from the community providers. Has that been the case in assessing the relative impact of LD 98?
Yeah, we certainly have done some of that. We have certainly spent a lot of time working with providers, advocates, and others about the changes that we must do in order to come back into compliance with the Child Care Development Block Grant. We spent a significant amount of time in 2019, for example, at the annual Child Care Conference that happens here in the state. Spent the better part of an entire day of presentations to providers and advocates and others explaining why we were going down this, taking these steps. And while some, I will say, would probably prefer to see some of these provisions not enacted, I think everyone understood that we do not serve our children and families best when we leave federal resources that are available to us untapped or on the table. We simply, in my opinion, cannot afford to leave $800,000 that could benefit working families and providers in the state of Maine when we can make these changes. They align with best practice. They align with federal regulations, as I said. They support health and safety for children in these providers' settings. And I think everyone understands that's to the betterment of all of our Maine children and families.
Okay. Any questions? Do any of these newer standards exceed federal requirements?
I will say that there are some things that are not in federal requirements that are in our state requirements. And so in that case, I suppose you could indicate that, because federal requirements don't say what kind of licensing we have to do. They just say they have to be licensed, and they leave those specific determinations to the states or the public entities. But in general, these align with federal guidelines and best practice standards, and where required, it absolutely comes into direct compliance with those federal block grants.
Great, thank you. Yes, Representative Zager.
Thank you, Mr. Chair. Dr. Landry, does the change from certification to licensure mean anything is different in terms of fees paid or money received by the department?
No, not to my knowledge, it doesn't. Again, the federal block grant requires that we license facilities. And so really it's more of in my opinion, it's more of a technical change.
Thank you.
Are there any other questions of Dr. Landry? I don't see any. Thank you for being here. So anybody else who wants to speak in favor, in support of this bill? I think that would be you, Ms. Frillo, on the list that I have.
Hello again, Senator Claxton, members of the committee. Again, my name is Rita Furlow, Senior Policy Analyst at the Maine Children's Alliance. And we are, again, in support of the changes that are being made to help bring us into compliance with federal statute that the reauthorization of the Child Care Development Block Grant happened in now 2014. And so we very much appreciate this administration's efforts to come into compliance and make the necessary changes so that we make sure that Maine parents right, are not losing out on federal dollars that can support them in what we all know is childcare, which is very expensive for families. So we've never wanted to see the state potentially lose any of those federal dollars, and we appreciate the administration's efforts to make those changes. And I will say that Dr. Landry has been incredibly open. He participated in, I'm not sure if it was last week or the week before, but a session. He and his whole team came and met with a large number of folks from our Right from the Start coalition, to talk about the new changes that are going to be brought about in terms of some additional federal dollars. So again, we're in support of these changes and urge you to adopt them.
Thank you, Ms. Furlow. Not seeing anybody else here to testify in support. I also don't see anybody here to testify in opposition. So, but I do hear, I had you down, Mr. Murray, as neither for nor against, but you can assume any category you want and join us.
Thank you, Senator Claxton. Representative Meyer, I appreciate the opportunity. I am testifying in opposition to this bill. My name is Nick Murray, policy analyst with Maine Policy Institute. We're a nonprofit that advocates for public policy to expand economic freedom and individual liberty in Maine. So thank you for the opportunity. Over the last decade or so, Maine parents have been frustrated with the lack of affordable childcare, and for good reason. From 2008 to 2018, the state lost 1/4 of all licensed childcare providers, with even steeper losses among family care providers. All 16 counties experienced at least a 20% drop. 11 counties had a drop of at least 35% among family care providers. Family childcare is historically the most accessible and affordable option for Maine families, yet the actions of the legislature continue to result in the closure of these facilities across the state. As I noted, that historical trend over the last 2008 to 2018, that trend has gotten even worse over the last year. Half of Maine's childcare spaces closed by July 2020 versus 2019. So we agree that there's a serious problem with the availability of childcare in Maine, but allowing the office to regulate quality is a subjective, needlessly onerous rule that can only exacerbate our problems and leave more parents and providers out of the loop. There are two measures of quality as it relates to childcare: structural quality and process quality. Structural quality encompasses easily observable features of a care environment, such as child to staff ratios, education requirements for staff, etc. Process quality refers to educational programming and the quality of interactions between children and providers. Rarely do state regulators consider process quality, which have a greater impact on the quality of care received. Instead, regulators usually focus on strict structural quality reforms, which do not ensure or guarantee quality in a care environment, but do significantly raise the cost of services. Just to put Maine in perspective, 14 states permit staff to watch more infants than Maine's ratios allow. 28 states allow staff members to supervise more toddlers and school-age children than Maine. 25 states have less restrictive ratios for preschool age children. So children in these states are not at a greater risk of death or serious injury because of these rules, and the care they receive is still high quality. Rather than regulating providers out of the market, these states have established regulatory environments that give providers flexibility to keep their doors open. So my question to you, why do we continue to make childcare less accessible and less affordable? I don't believe Maine had this problem 30 years ago, but we've seen over the last 10 to 20 years, we are severely reducing supply. We're severely reducing options for families. This translates to higher costs, and we've seen that bear out in the data. Quality of childcare is not determined by the mountain of regulations governing the service. So let's at least look to national or regional averages and point our rules towards greater flexibility, lower barriers for providers, before we impose more government scrutiny on a critical industry that's already struggling. So thank you so much for your time and consideration here in my points. And I appreciate, I'm ready to take any questions, but I have included these sources for this data in my testimony.
Thank you for your testimony. Thank you for being here. Are there any questions for Mr. Murray at this point? And do you think you'll be joining us for the work session later on when that gets scheduled, or?
Sure, I'd love to.
Okay. All right. I don't see any questions. Thank you for being here again. And I don't see anybody else who'd like to testify against. And we haven't added anybody recently since I last checked in with Carrie. So are there questions we'd like to direct to the analyst staff in anticipation of the work session? Representative Javner? Oh, I thought you were reaching for your hand signal. Yes, Representative Zager.
Thank you, Mr. Chair. I am wondering if we could get an update on the number of childcare spaces. Mr. Murray just testified in his testimony. There's a graph that's showing number of childcare spaces precipitously dropped between 2019 and July 2020. The situation may be different now than it was in July 2020. So I'm interested in if there's any updated data on that. For the work session would be fine.
Okay. Okay.
Available now.
Any other questions for the analysts, for our analysts? And I don't see any. So I think that'll conclude the public hearing portion of LD 98. Thank you all for coming to testify. Thank you for the questions. That concludes the public hearing portion of this afternoon. The only other agenda item that I'm aware of is to take a quick look at maybe the reports by the committee and trying to get some folks lined up in a chute for the next opportunity to compete with Representative Javner's presentation. So Anna, do you want to walk us through the?
Well, I have most of them signed up for, actually. I don't want to particularly share my screen, although I'd be happy to send them out again. Okay. But I think there's only a couple that haven't been signed up for. We don't have anybody signed up for the HIV/AIDS Advisory Committee report. And we don't have, I think the only other one is, sorry, I'm not good at multitasking here. The fourth quarter report for seeking a waiver for main care coverage for parents during rehabilitation and reunification, and the Maine Developmental Services Oversight and Advisory Board annual report. Those are the only two I don't have anybody signed up for. Everything else is signed up for, but Representative Javner was the only one that volunteered to present this week.
Okay, and those are all listed on our committee materials website?
All of the reports are, and I'm happy to send out updated lists just to remind you if you've forgotten what you've signed up for. But if anybody wanted to sign up for those three, that would be good.
And they would do that through you because we can't sign up online.
No.
That's right. Okay. Just want to be sure about that. Yes, Representative Craven?
Yeah, I can check the AIDS report.
Okay.
And the reason, so we're already on the roster for next month to present our reports that we signed up for already. So I have that.
Thank you. Senator Moore?
Yes, I would take the one on the reunification. I was trying to find it again.
I'll send it to you.
Okay, that would be great.
I'll send you the link again.
Okay, that'll be great. Thank you.
So that just leaves the OAB.
Representative Griffin?
Happy to take that one.
Okay.
Thank you all. Thank you all for stepping up. Now the next step is to, yes, Representative Perry.
This is going to sound crazy, but I don't remember what I signed up for.
Yeah, I knew you were going to say that. That's why I'm going to send out the charts again to everybody to remind you what what you have. I'm just gonna pull up a calendar while we're at it.
Representative Perry won't be the only one to benefit from that, I'm sure. Thank you.
Okay, just gonna pull up a calendar here to see if you might want to, because I don't have anybody signed up for specific times. The only person I had signed up for a specific time was Representative Javner. So
The way
I
the
don't-
work sessions are going for the budget, we
Yeah.
often have time at the end of that.
Right. So you
that'd
have
be
Monday afternoon
Yep.
and Wednesday afternoon. You also have budget work sessions on Tuesday and Thursday, but they're in the mornings. So Monday and Wednesday afternoon would be good ones.
And Tuesday afternoon only includes 4 bills.
Yep.
So that might be an opportunity there. And we're going to change. So this 9 o'clock start time is okay on Tuesday. Am I right?
Yeah,
about that?
we can't move Dr. Shah.
Right. And the 9 with Dr. Shaw. So we might have some time after that 9 o'clock start on the work session on Tuesday too.
Yeah.
All right. So there'll be several opportunities next week. So can get in touch with Anna about which one you're ready. And then you can either pick a day or just be waiting for your turn. Yes, Representative Stover.
I just wanted to ask, I'm looking at the list and I don't see, I know I signed up for the CACs, the advocacy centers, and I don't see it on this list unless I
see.
Unless
I mean, part of the problem is there is 2 lists because there are still some left over from last year that have been signed up for. So I find myself looking for them too, Representative. I'm like, oh, I'm on the wrong list again. So
okay.
Yeah.
Right.
So you might be looking at the one from last year because that's on the list for this year. Oh no, the other way around. The other way around.
Yeah.
Yeah. So that's okay. I will send out both lists again, and I will send out the links again. If you have a report from the 129th, you have to go to the bottom link on the committee website where it says 129th and click through. But there aren't too many of those left. It won't be long before we don't have to operate with a double entry. The sooner we can get rid of the 129th ones, that will make my life a lot easier and all of yours as well. So I will send out both lists, and I'll just find that again for you, Representative Stover. You won't have to, because they are a lot easier to find this year than they are to find last year because of the way the website is
The way they're organized. Yeah. Okay. All right. We'll look forward to those in the email. Any other items of business to be dealt with before we conclude for the afternoon? I see one head shake from Anna. Is your hand down now, Representative Stover? Even though
Oh,
it's
yes.
still up?
I
Okay.
forget to put that down.
Well, normally I can help you, but this afternoon it doesn't let me do that for some reason. Then I think we'll entertain a motion to adjourn with the idea of meeting again at 1 o'clock on Monday the 1st. You know, we apologize, chairs and leads, about moving to a Monday date, but we tried to work that around. Just we need to make sure with losing 2 days for the House and the Senate in session, we needed to get done by the 19th. So apologize for that. We won't make that a regular recurring habit if we don't have to. So, or until we have to. That's probably the better way to put it, because we're going to end up with 5 days eventually. So I'll entertain a motion to adjourn.
So moved.
And a second, I see. All those in favor? Thank you and have a good week.